You recently had a foot or ankle surgery, or maybe you had this surgery years ago. Either way, you still feel pain, you have stiffness and tightness in the ankle and foot. In this video, we're going to be talking about some of the tissues that need to heal after surgery, and we'll discuss the timeline of healing for those tissues. In addition, we're going to be talking about the typical physical therapy plan of care after surgery, and we're going to discuss what you can do right now to feel better if you still do not feel 100% after finishing your standard physical therapy plan of care. So keep watching this video because at the end, I'm going to be showing you guys a few different options to really feel better. As a medical disclaimer, make sure that you follow the advice of your surgeon and your physical therapist. If you recently had a foot and ankle surgery, you want to make sure that you're following those post-op guidelines because you often have strict weight-bearing precautions and you want to make sure that you don't compromise the surgery. So the information that I'm going to be telling you is going to be for general information and educational purposes only, but if you're looking for personalized advice, again, make sure you talk to your doctor and your personal physical therapist. Also, I want to encourage you to hang in there. I know you've been through a lot to get to this point. You likely had a traumatic injury to your foot or ankle, like a bimalleolar ankle fracture. You could have broken the bone. You could have had a bunionectomy, having surgery to your big toe. You could have had really bad plantar fasciitis and got surgery for that. You also could have had your ligaments reconstructed. No matter what type of issue that you had, these are all serious issues. It takes a little while to heal. So we'll go through each one right now so you have an idea of how long each of those structures could potentially take to heal. So for example, if you had the bone that was involved, bone typically takes about 6 to 8 weeks to heal. It's going to be relatively stable if you had an open reduction internal fixation. That's known as an ORIF, and if you look at your x-ray, you're going to see a lot of plates and screws in your ankle joint. And if you had that, then you're likely going to have some weight-bearing precautions after the surgery. You're likely going to be wearing a boot, and your surgeon's going to have you be in a wheelchair or use crutches for a period of time until you have a follow-up appointment. Now, you want to respect that healing time of the bone, and you don't want to stimulate the bone too soon because that can delay the healing. And once the surgeon lifts those precautions, then you need to load and put weight into that bone to allow it to heal optimally. So you're basically trying to put the optimal amount of load into that bone to facilitate the healing process, and an experienced physical therapist can help you with that process. If you had the muscle or the tendon reconstructed, then that often takes longer to heal than bone. The recovery time for tendons takes about 16 to 20 weeks. And if you have surgery to those structures, then the surgeon will often put you in a boot and you'll be non-weight bearing for a period of time as well. And that's because if you're standing and walking, then your muscles are going to contract and they're going to be pulling on that tendon and potentially compromising the surgery. Now, this is a difficult part of your body to heal because you have a lot of body weight onto it when we stand and walk. When you actually take your step, you're putting your full body weight onto the foot. And that is a lot of stress on structures that were just surgically repaired. So if you have the tendons involved and muscle involved with your surgery, then be very patient with that process. And very similar to it's really similar to the recovery process for the bone in the sense that you want to load that tendon optimally once the surgeon lifts those weight-bearing precautions. So if you are allowed to put body weight onto it or partial weight onto it, then with the guidance of your physical therapist, you're going to be doing some exercises and mobility for the ankle to put a little bit of stress into those muscles to get some blood flow, to stimulate them, and to develop a better resiliency to different loads and forces. And ultimately, that's going to be helping those structures to heal over time. If you had the ligaments reconstructed, then that takes the longest to heal. The recovery process for ligaments can take 6 to 8 months to fully heal. And that's mainly because ligaments do not have good blood supply. Tendons and muscles have better blood supply than the ligaments. Bone heals the fastest, then we have tendon, then we have ligament. So if you have all three structures involved, the thing that's going to limit you the most is going to be those ligaments. And the thing about ligament injuries is the fact that sometimes the ligament is not painful anymore. So you can feel really good, but just because you feel good doesn't mean that you're 100% yet. You have to respect and understand that that ligament takes quite a few months to develop its strength again and to reconstruct and to be basically a stable and strong structure, which is what you want for the ankle, because ligaments are different than the muscles and tendons. A ligament provides a passive stability to your foot and to your ankle. And that's why if you are somebody that has suffered with chronic ankle sprains in the past, let's say you used to play basketball or soccer, or you like to hike and you keep spraining and rolling your ankle, then those ligaments start to get loose and it becomes easier to roll your ankle and sprain your ankle again. So we want to make sure after the surgery that you're not going to overstretch those ligaments. We want to give the ankle and foot plenty of stability by allowing those ligaments to fully heal. I mentioned before that you might be wearing a boot after your ankle or foot surgery. Those are often called cam walkers. It stands for controlled ankle motion. If you wear a boot, it could be a blessing and a curse. It could be a blessing because it protects the foot and it allows you to walk while protecting the foot, and it allows those structures to heal. So once your surgeon allows you to put weight onto it, you will often wear the boot first for walking and getting around. Now, the thing that really limits people with the boot is that it alters mechanics when you're walking. So if you're using the boot, it restricts the motion of the ankle. It restricts motion going this way, which is known as dorsiflexion. So it basically keeps your foot at about a 90-degree angle. So as you try to take a step, you're not able to. So then your knee bends, your hip pops out, and it puts stress on your lower back. And what happens is when you wear a boot for too long, you start to develop these different compensations in the way that you're moving, and you can start to stress your knee, or you can start to stress your hip or your back, and that could really reveal an underlying issue if you have issues in those areas in your body. Another downside of the boot is that it restricts mobility of the ankle. If you're wearing it for 2 months, your ankle joint can get really stiff. And when you stop wearing the boot and you're trying to improve mobility of the ankle, you might notice that it's painful to move. You might notice that your toes are stiff, the ankle joint might be stiff, and it's going to be difficult to restore that motion. So that is a serious downside to the boot, but because those tissues need to heal, you definitely want to wear it, and you definitely want to follow your surgical guidelines. Now that we have a better understanding of the biological healing process of the ankle and foot, let's discuss how physical therapy can help you get better. After your surgery, your doctor is going to refer you to go see a physical therapist. You're going to initiate a formal physical therapy plan of care, and this will typically be covered by your insurance company. They'll typically provide 12 visits to 24 visits. This is longer than most plans of care because it is an extensive rehab process. In physical therapy, the physical therapist is going to be following the precautions that the surgeon gave you. So if you're not able to put weight into the ankle, then the initial stages of your rehab are going to be very simple. It's going to consist of working on gentle mobility of the ankle. You might be actively moving the ankle up and down by doing exercises like ankle pumps. You might bring the foot down and in. So it depends on what structures were healed. That will also determine what types of exercises you'll do. For example, if you had ligaments reconstructed on the outside of your ankle, then the physical therapist is probably not going to have you do a lot of exercises where you're bringing your foot down and in to the point of stressing those ligaments. So we want to make sure that you're following those guidelines precisely, and that you're not just going online to Mr. Google and finding different ankle exercises at this point in your recovery process. Now, as you progress, you're gonna start to improve your ankle motion. It's gonna slowly get better. It's gonna seem like it's taking a long time. It's gonna seem like it's watching like paint dry because your ankle is really stiff. It's in the boot, and right after the physical therapist helps to mobilize it, then you have to wear the boot again and it gets stiff. So you just go through this cycle in which you feel like you're not really making a lot of progress initially, but then once you're able to start putting more weight onto the ankle, once you can start doing partial weight or full weight onto the ankle, you're gonna start to see that your motion is gonna dramatically improve, and you're gonna start to feel like yourself again. You're gonna be able to stand, you're gonna be able to walk a little bit, and the physical therapist is gonna help you with that process. They're gonna be able to guide you with managing that load to the bone, to the ligaments, and to the tendons. And in addition to that, you're gonna be strengthening all the muscles that are around the foot. You're gonna be working on the outside of the foot, on the inside of the foot. You're gonna be working on the calf muscles. In fact, you're gonna be working on the hip muscles because your hip will be very important for controlling the position of your limb. So these are all the different types of areas that a physical therapist is going to look at, and they're going to be giving you the exercises that are most appropriate for you based off of your limitations. And it's a little bit different for every person because each person has a different area that they really need to focus on. And so you want to maximize your time with the physical therapist by focusing on those areas that are mostly restricted. The whole physical therapy plan might last for 2 to 4 to maybe even 5 months, but at a certain point, the insurance is no longer gonna cover you for your recovery process. At this point, you're probably able to walk, you have better motion, you have better strength in the ankle and in the foot, but you may not feel like you're 100%. And this is the part that I really feel passionate about because I realize that there are so many people that go to physical therapy or they go to their doctor or podiatrist and they are experiencing pain in their foot and ankle. And these healthcare providers are doing their best to help you. They're trying to evaluate your foot. They might give you injections, they might do surgery, you might do physical therapy. These are all the different types of interventions that can help you recover from a foot and ankle injury, but you still might be limited. And because the foot and ankle is such a vital part of our life, it tends to have a very intense impact on our emotions. I've noticed that a lot of my clients or former patients that have been dealing with these foot and ankle issues will feel a lot of emotions involved with this recovery process. Because it affects nearly every single part of your life, it's very easy to have a little sense of PTSD when you're recovering from these issues. And even just probably listening to this video kind of just reminds you of this whole entire process of what you're going through. So I want to just reinforce the fact that you're doing good, you're doing your best, and at times, not everybody is able to fully eliminate pain. But if you can improve your function, then that is a significant milestone. If you are able to improve your function by 25% or 50%, that is great. Let's say, for example, you're having pain walking 1 mile. So if you can walk 1.5 miles, then that's a great improvement. If you can walk 2 miles, obviously that's even better. And you need to walk before you can run. So just focus on these small milestones and just be successful with those, because human psychology tells us that if we have these small wins in our life, then we're more likely to go after those kind of bigger goals. But we don't want to have failure, and if you have failure in your rehab, then it's going to make you not want to participate in your exercises. It's going to make you want to sit at home and just get very bummed out. So I just want to encourage you to stay positive with the process and realize that your foot and ankle could potentially take 1 to 2 years to fully heal. So right now I want to discuss a few options that you can do to help improve your ankle mobility, strength, and potentially fully eliminate pain or at least significantly reduce pain. The number one option that I would recommend to recover from persistent and chronic ankle pain after surgery is to go through a proper strength training program. At this point in your rehab, you're able to do more now. We can start focusing on your hip strength, we can start focusing on your calf strength, and developing the muscles that are gonna support your foot and your ankle. By building up strength in these key muscle groups, you're gonna be able to reduce and alleviate the strain that is gonna be put on your ankle joint. So if you're having persistent and chronic pain, getting stronger is gonna be one of your best options. But at this stage in your recovery process, we still want to manage the amount of load and force and resistance that we are putting onto the ankle. So if you try to do this on your own, which you can do, but I would advise that you get some professional guidance, because if you try to go to the gym and you start taking up some of these other activities, you might re-injure your foot or ankle just because you may not know how much to do. But your physical therapist can coach you and guide you and supervise you with doing the right exercises at the right time. Because if you do exercises that are too easy, then you're not gonna stimulate your ankle enough and it's not gonna adapt and improve. And if you do exercises that are too hard, then you might end up stressing the ankle, straining the tissues, and having flare-ups and setbacks that can delay your recovery process. So we want to make sure that we're going to reach that sweet spot of your recovery, and you're going to be making forward progress and then mitigating and managing those valleys in which you have those setbacks. And unfortunately, the flare-ups and setbacks do occur. It is part of the process. It's not going to be a complete linear journey to get to the top of the mountain. There's going to be a few moments that you feel really frustrated and down on yourself. So it is very helpful to have accountability and to have someone like a physical therapist help you during those moments to help you realize that you are moving in the right direction and that you are doing what you should be doing. If you are feeling motivated to start a strength training program, then we can provide you with the guidance and supervision that you need from doctors of physical therapy. We're able to offer you online physical therapy if you live in California. This is a completely new approach, but we can accurately assess your movements online through a remote consultation. We can assess to see your movement patterns, we can get an idea of your ankle mobility, and we can measure your strength to determine what exercises are going to be the most appropriate for you. Then we can supervise your response to these exercises to make sure that you're moving closer to your goal and closer to feeling 100%, while managing any kind of setbacks and frustrations along the way. So we'll be able to keep you accountable. Now, if you do not live in California, we can still help you with strength training programs, but this is not considered physical therapy. These programs are more for the promotion of your health and fitness, but these are not to treat pain. Basically, these programs are to promote better movement, better quality of life by helping you get stronger. So if you are interested in either one of these approaches, then head over to our website. It's evercorelife.com. You can learn more about our company, about what we do, and we also have plenty of resources there for you. So we have additional YouTube videos that we post on our website, and we have plenty of articles that you can read to learn about foot and ankle health and various foot and ankle injuries. So by reading these articles and educating yourself, you're gonna end up feeling more empowered and be able to really maximize your quality of life and your function. If you benefited from this content, then make sure to share this video or our website with a friend or family member. We want to help millions of people who are struggling with pain and injury, and it means a lot if you help us share our message. We realize that the healthcare system is very reactionary, and it can do a lot more to help people live a fit, healthy, and fulfilled life. And that's what we want to do as a company. So if you guys want to stay involved with what we're doing, then interact with our website, bookmark it, visit it, share it with a friend, make sure to subscribe to this channel, and then turn on your post notifications so you guys know when our newest videos are released. I'll see you guys soon.